दैनिक निष्पक्ष पोस्ट, दर्पण सच का, समय से पहले, खबर से आगे।
Hello and welcome. You're watching Dainik Nishpaksh Post, where the news is not about sides, it's about the truth. Unbiased, unfiltered, for the people.
11 session, 40 spokesperson and 500 doctors. Exchange of technology took place between top cardiologists of country. Kanpur Cardiology Summit was inaugurated in Status Club. As the main event, Kanpur Metabolic Committee, LPS Institute of Cardiology Kanpur and KKR Hospital conference were organized. Chief guest of the conference was Chairman of Cardiology Society of India, Dr. Sanjay Tyagi. Special guest Dr. Aditya Kapoor, PGI Lucknow, and Director of Cardiology Kanpur, Dr. Rakesh Verma, and India's top cardiologist, Dr. Viveka Kumar were present. During the summit, HOD of Cardiology Kanpur, Professor Dr. Umeshwar Pandey, Professor Avdesh Sharma, Cardiologist of KKR Hospital, Dr. Amit Gupta, GRS Hospital Kanpur, Dr. Neeraj Viryani, and Dr. Viveka Kumar have discussed basic and advanced technology with Bureau Chief Dr. K.M. Tripathi.
Today we are on the occasion of the Cardiac Meet Summit at 2025. We are along with the Dr. Amit Gupta. What do you think about the presentation in the cardiac, and what do you think about the future of the cardiac surgeon?
Today we are organizing a summit by name of Kanpur Cardiology Summit, where around 500 doctors from across the country are attending this conference. And in this conference, we are not only discussing about the core cardiology topic, but also what is going latest in the field of cardiology, so that everyone should get updated knowledge. Is like that, it should be exchanged between the doctors. So we have included the basic cardiology topics, advanced cardiology topics. If I like to mention about few important topics, like we are discussing here in about metal-less PCI. This is the latest technique where without putting a stent, you open the artery, the closed artery, where we use the drug-eluting balloon to open the closed artery. So about this technique, we are training the doctors. We are talking about the leadless pacemaker, where we don't need to put a pacemaker. It is the leadless pacemaker which is directly implanted in your heart. So such an advanced technology we are discussing in this summit.
With us, report from Dr. K.M. Tripathi, Bureau Chief, Kanpur. Along with the top cardiologist, Dr. Viveka Kumar, is in the present the paper. What about the paper, and what do you think about the latest amendment in cardiac system?
Yes, so thank you very much. I am come here for Cardiology Kanpur Summit, where I presented my lecture on TAVI procedure, which is without open heart surgery. We changed the valve and it was very well received. I told about the step-by-step procedure, how we do it and how can it safely be done. My second talk today was on how to do a leadless pacemaker without any wire, without any pulse generator. So these advancements have made life easy for the patient, and even complicated patient can have a very good outcome. So those patients who cannot tolerate general anesthesia, cannot tolerate open heart surgeries, the new advancement has really made huge changes, and they can live longer and have less complication.
Doctor, nowadays the patient of mostly increasing in the cardiac system, and that are covering the young generation. What do you think about what are the basic precautions you have to be taken?
Yes, so it boils down to, India has become, unfortunately, the world capital of heart disease. So basically the lifestyle and eating habits is to be, controlled. So we need to have less, less stress. So we say that the food should be less in carbohydrate, less in fat, regular exercise. These things are basically important. And then on top of that, a regular checkup, because our patients come very late. They don't have regular medical examination checkup, so that in the end stage they will come where the risk of the procedure is also very high. And if it is detected early, it can be prevented and it can be controlled, so that the end stage procedure is required after many years.
What about the minimum age to do medical facilities have to be for cardiac?
Yeah, so I think the cardiac checkup should start at the age of 30 years, and definitely after the age of 40 years. and once in a year or once in a 2 years, the regular checkup should be done. Those patients where the family history is very strong, or those who have got diabetes, those who have got high blood pressure, in those situations, they should start getting checkup done early. They should work on the risk factors like smoking, alcohol use, and lack of exercise. So these are the things which increase the risk of cardiac complication, and that should be, educated to the patient. So single big thing which can decrease the risk of cardiac event is, stopping the tobacco in any form, either smoking or tobacco chewing should be stopped completely.
Thanks for discussion with Dr. K.M. Tripathi, Bureau Chief, Kanpur.
Of cutting balloon angioplasty, the balloon which has a blade on it, it cuts these dense fibrosis effectively and relieves these patients. We are obviating the need of failed implantation which we avoid in these patients. We published our results of balloon angioplasty for renovascular hypertension in American Heart Journal 1993, which showed
who was 70 years old age, he had severe aortic stenosis, severely symptomatic, and you can see that the mean gradient was also very high, and he had ejection fraction was dropping, so he was in follow-up for almost 5 years before he could decide that he would have non-surgical method of aortic valve replacement, which is called TAVI or TAVR procedure. So what you really need is that after you have selected the patient, we need to, because 95% of the whole procedure is planning by a CT scan. So CT aortogram, and simultaneously you can have a, the coronary angiogram as well, to have a fairly decent idea that how to know that how the coronaries are, whether the
If you found this news useful, don't forget to like the video. For more reliable and fast updates, subscribe to our channel and hit the bell icon to stay ahead with every important update. Thank you for watching.